Good morning, Mr. Hughes. How are you today? I've heard some exciting news. You're getting to go home. But before we let you go, I wanted to talk with you about your hospital stay. While you're here, you were diagnosed with gastroesophageal reflux disease, or what most people call GERD or even acid reflux. I'm sure you've heard of or know people that have this condition, and we want to make sure before you're released home that you know what it means and how we're planning on treating you. While this is a very common condition, leaving it untreated can lead to very serious consequences, and we want to work with you to make sure that doesn't happen. With GERD, the valve that's between your esophagus and stomach that holds stomach acid in the stomach and out of the esophagus is not working. This means that stomach acid can come through the valve and get into your esophagus, causing many of the symptoms that you're experiencing, such as heartburn and chest pain. With GERD, you may also experience upset stomach, regurgitation, difficulty swallowing, or breathing problems. Your caffeine intake and smoking put you at a higher risk for GERD. The good news is that both of these are factors that you can control. I would be happy to talk with you about quitting smoking and ways to limit your caffeine intake if you're interested. There are many resources for smoking cessation and alternatives to caffeine that we will happily connect you with whenever you would like that information. While there are things that you can do to improve your risk for serious consequences from GERD, such as ulceration or cancer, your doctor has also prescribed a medication called omeprazole that is designed to help manage the condition. Omeprazole belongs to a class of drugs that are known as proton pump inhibitors that help to control GERD. This medication works by blocking the secretion of hydrochloric acid in the stomach. The doctor has prescribed this medication as a short-term medication to help get your condition under control. So just be aware that at some point your doctor might change your medications to include more of a long-term maintenance drug. It's always best if you can keep taking it at the same time every day. After a couple of weeks, the doctor would like to see you to monitor how you're doing. It's great if you're able to monitor your symptoms at home and keep a record of it, but if not, that will be okay. The doctor will be monitoring you closely to make sure your GERD is responding to this medication and to make sure that you're tolerating the medicine well. There are a couple things that we need to watch for with this medicine. It is generally very well tolerated, but can cause issues if taken long term. When taken short term, there are relatively few side effects. However, if you take this medicine long term, you could be at risk for pneumonia, bone loss or hip fracture, and even stomach cancer. Your doctor will be monitoring you often for any adverse reactions and monitoring your symptoms based on the length of time you've been on the medication. But if you have any questions at all, please feel free to call your physician's office at any time. I think that's a lot of information. Do you have any questions that you'd like to ask me, or any other information, such as how to quit smoking or caffeine alternatives that you would like me to get resources for you? All right, that's great. Just to make sure that we're on the same page, can you tell me what your plan is for when you get home? Perfect. You're going to take your medication as instructed and monitor your symptoms, and also see your doctor on a regular basis. That sounds great. It's been a pleasure taking care of you, Mr. Hughes.